12:25 now, and time to answer some common health questions. And joining us is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you so much for coming in today.
You're welcome. Good to see you.
Good to see you too. I don't know why I have to read that in the prompter every week. I never do. And you make us all smarter. So here's our first question for you. What is the best way to prevent heartburn?
Yeah, there's a price to pay for everything, isn't there? I mean, heartburn is really composed of two things. The acid in your stomach, and then the relaxation of the sphincter that is between the stomach and the esophagus. So you focus on those two things, you can prevent, or do the best you can at least, to prevent that reflux or that heartburn. So smaller meals so you don't put pressure on the sphincter. One way to do it. Decrease foods that increase acid production or relaxation of the sphincter. So things like fatty foods, citrus-based foods, tomato-based foods, good stuff like chocolate, cola, coffee, alcohol, tobacco. I mean, you're thinking to yourself, why live, right? Well, I mean, things like starches and vegetables, things like that are okay in the stomach. In other words, the bland foods aren't going to increase acid or relax the sphincter. Now, also, at night, don't eat right before you go to bed. Give it at least 2 hours, because otherwise the gravity is going to pull it up to your esophagus and cause some heartburn. And if that occurs, elevate the head of your bed. A couple of pillows or put some bricks. In other words, give it a little bit of a degree so that your head is higher than your stomach. Helps out considerably. But keep in mind one thing very important, and that is that if this is the first time you're having it, I do not want you to assume that it's from your stomach. Could be something more serious like your heart. Come see us. Let us make that determination.
Okay. Don't eat before bed. So that spicy chicken before Popeyes I had.
Not a good idea.
It was not. I'll tell you that. All right. Here's our next question. How do you stop heart palpitations?
Yeah, heart palpitations, it depends on what's causing it. There's two categories. One is a conduction abnormality in the heart, meaning skip beats or an elevated heart rate, or another category is caused from the adrenaline from anxiety or a panic disorder. That's a whole other conversation. Let's talk about the conduction abnormality. So first, you want to know what's causing it. So one of the more common causes is an electrolytic abnormality. You want to get your electrolytes checked because that can commonly cause some skip beats. Sodium, potassium, calcium, electrolytes like that. Get them checked. If those are abnormal, could be from medication, could be from your diet. Make sure we get those corrected. Dehydration this time of year very commonly can cause skip beats. Make sure you rehydrate. And if those don't work, then there is such a thing called a Valsalva maneuver, which is a vagal maneuver. You bear down, and that stimulates the vagal nerve and actually drops the heart rate. You can do it by coughing or even splashing cold water on your face. Those actually are very effective. Now, again, one more caveat or caution. And that is that if you have these palpitations and they're associated with dizziness or shortness of breath or chest pain or sweating, again, don't just sit at home trying to get it to stop. I want you to come see us. Again, it could be the sign of something a lot more serious. So,
all right. Thank you, Dr. Soria. Always good advice for us. And we will see you next week.
You betcha.
And we will see you after the break.